Hi, my name is Randall A, and you have joined me on the Infertility Channel. I wanted to thank you for being here today. And I'm going to start with another one of your questions. And this one comes from Lisa from Sydney, Australia. In fact, my brother David lives in Sydney, Australia. So Lisa, if you see my brother, tell him to behave. Anyway, she asks, Dear Dr. Randall, I have had 2 miscarriages in the past, and my doctor is recommending IVF with pre-implantation genetic diagnostic testing. What do you think? Excellent, excellent question. So let's talk a little bit about that. First of all, about 1 in 5 to 1 in 4 clinical pregnancies are lost. Now, what is a clinical pregnancy? A clinical pregnancy is one where there are symptoms or signs of pregnancy. In other words, nausea, vomiting, breast tenderness, fullness, irritability, or maybe there's been an ultrasound of the baby. So again, 1 in 5 to 1 in 4 lost. What do we consider recurrent pregnancy loss? And I assume by your question that these have been more than just little positive pregnancy tests on a paper. They're truly clinical pregnancies. If there have been 2 clinical pregnancies lost, we call that recurrent pregnancy loss or recurrent spontaneous abortion. And very interestingly, there have been new guidelines established for looking at the reasons for those miscarriages. Just a year or so ago, the workup was more exhaustive, more thorough, and today we're looking at the key reasons for those miscarriages. Now, if you think about it, in the first 12 weeks of pregnancy, there are a lot of possibilities for genetic errors. We've talked in a previous episode about so-called aneuploidy, which means abnormal chromosome copy number. Oftentimes that comes from the eggs of an older woman, but it can also occur not just when her eggs are developing, but also in the early stages of embryonic development, when that embryo is going from 2 cells to 4 to 8. What we and others have noticed when we make embryos and we biopsy them on the 5th day stage, we are seeing a disproportionately high number of genetically abnormal embryos in women who have unexplained miscarriages. I know that's a mouthful. So let's say we have put you through all of these tests and everything came back normal or negative, and you go on to IVF as your doctor's recommended for you there in Sydney. Well, he might find, and I don't know what your age is, but he might find even if you're young, you might have many of your embryos, or maybe all of them, that are genetically abnormal with no normal embryo to put back. I've had a couple of recent patients, in fact, both in their mid-30s, both with multiple miscarriages, one of whom had 8 embryos and only 2 of 8 were genetically normal. We put one of those back and froze one. She's now pregnant. And another one, also in her mid-30s, had 13 embryos and only one of those was genetically normal. So I put that one back and she's now pregnant. So it is probably a very cost-effective way in patients who have repeat miscarriages, especially if those miscarriage types are unknown, to proceed with genetic diagnostic testing and going on. Now, is that a perfect solution? Could there be a miscarriage in IVF like that? Absolutely there could. But we do believe that that increases your chances for ongoing pregnancy and might decrease the chances for miscarriage. So great question, Lisa. I'm so thankful you asked. One more tidbit. It's probably appropriate for many patients who have repeat miscarriage to see a psychologist. There's a lot of stress with a miscarriage, let alone 2 or 3 or 4. And I've had patients who have had multiple miscarriages up into the teens. Thanks so much for joining me. Lisa in Sydney, Australia, thanks again for your question. Great question. PGD, pre-implantation genetic diagnosis, may be the way to go. See you next week. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility Channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week.